This is Dr. Caudill Miller with Dr. Miller's Guide to Neurology, and today we're going to talk about Chiari malformation, mainly talking about Chiari 1 malformation. Now, Chiari malformation was named by Dr. Hans Chiari, who was an Austrian pathologist, in 1891. Later on, Dr. Julius Arnold further expanded on the diagnosis of Chiari malformation, and so there's a little argument when I first trained about what the name was going to be. Now, mainly type 1 we call Chiari malformation, type 2 we call Arnold Chiari malformation. So that's sort of the history. Now, Chiari malformation is when the cerebellar tonsils extend more than 5 millimeters below the level of the foramen magnum. Now, there's a hole in the base of your skull that obviously your spinal cord has to exit the brain to get to the rest of your body. This is called the foramen magnum. And I sort of like to think about an embryo. Your brain is made like in your stomach, in your mama's womb. And then it's drug up the spinal canal, and there's a little fingerlet, like a Portuguese man o' war. That's why I like to describe it. And this little tonsil, this little fingerlet, sticks out of the foramen magnum about 5 millimeters. It actually looks like your uvula, or what Charlie Brown's tonsil, you know, when he screams. They call it the tonsil, but it's a uvula. But you see Charlie Brown screaming, you see his little uvula. But this tonsil looks like that. And it probably does something in embryo. It's just worthless when you become an adult. So you can cut it out and throw it in the trash and it doesn't hurt anything. So a large number of people have Chiari malformation, huge numbers, and almost always asymptomatic. But some people do have symptoms when it presses on the brainstem. The symptoms are sometimes vague and hard, but people have headaches, they have dizziness. When it's real severe, they can have nausea. They can have neck pain, they can be unsteady, ataxic, lack of coordination. They can have some hand incoordination, have some speech trouble. Sometimes when they bend their head down, they get a sharp shooting pain. It's called a Lamette sign, and you see this with Chiari malformation, you see with MS. They have trouble swallowing, they have some tingling and numbness in their hands. 5 millimeters is the most acceptable cutoff for the degree of cerebellar tonsil below the level of foramen magnum. And so, people have any kind of symptoms, neurologists generally don't just worry about it. We send them straight to the neurosurgeon and let them decide. So this is sort of a normal film. This is what, you see the era draws a line across the foramen magnum, and that's what it's supposed to look like. And then here's one that's really severe. You can see those cerebellar tonsils. Once again, look at the blue era, way below the level of foramen magnum. Here's another one. The cerebellar tonsils well below the foramen magnum. Now this lady, this last one, her cerebellar tonsils were 20 millimeters below the level of foramen magnum. But she really had no symptoms at all. She was in a car wreck, had a concussion, so she didn't require surgery. So just because it's more than 5 millimeters doesn't mean you need surgery. So what is the treatment? There's really only one treatment if people have symptoms. It's an occipital craniectomy. They cut off the back of the skull and just make that foramen magnum breathe. You got to be real careful. There are cult groups out here that believe that Chiari malformation is the root of all evils. There's a doctor at one of the major medical centers. I've seen him on Today's Show. He thinks everybody with Chiari malformation, even a few millimeters, needs surgery. It's just nuts. And so you just have to really be careful and go to a really competent neurosurgeon, generally at a university. So Chiari malformation is not the root of all evils, but it should be evaluated by a skilled neurologist. And any symptoms at all more than 5 millimeters below the level of foramen magnum, refer to a neurosurgeon. So that's Chiari malformation. Like, subscribe, comment, and more later.